Thank you for visiting my channel, Medical Assistant with Miss K. My name is Kendra and I'm a medical assistant instructor. I teach both clinical and administrative skills. And if this is your first time visiting, welcome. If you're a returning viewer, welcome back. So today I am going to be talking about something a little bit different than what I normally talk about, but it's still going to be educational. So a couple weeks ago, Nick Cannon's comments went viral on feminine hygiene. Now, he said that 80% of all women do not know how to properly clean themselves down there. And I was actually glad that this conversation is happening because I feel like this is something that is very important to talk about among girls and also among women, because the reality is that not all girls are taught proper hygiene, and then they become women who don't know proper hygiene. So it started the conversation, and people started asking, well, is this true? Now, I don't think he should have generalized and said 80% of all women. Now, if he had said 80% of the women that he's experienced, 80% of the women he's come across don't know proper hygiene, then that could be a little bit believable, a little bit more believable, because we can't invalidate his experiences. That's probably what he has run into, right? And then knowing that that is a very real thing, that there are many women who don't know proper hygiene, it's believable, and so I was watching an interview of this esthetician, and she does waxes, and she said that she actually thinks the number may be about 40%. And this is just based on her experience, right? None of us, we don't know whether the number is 80% of all women. Nobody knows, right? Nobody has experienced every single woman in the world. But all we can do is speak from our experience. And so I wanted to do this video to speak a little bit from my own experience and also to educate you guys on some things, right? I want to talk a little bit about pH balance in a minute, because a lot of people talk about it, but some people, they don't even know what it is. They just know, oh, my pH balance, and doesn't even know what pH balance is, what it means, right? So I'm going to talk about that in a second. But, I mentioned I'm a medical assistant instructor. I have been in this field for 17 years, and my very first job was in GYN with gynecology in December 2004. And so I've worked in GYN a couple years, and then I worked in family practice for 4 years. And in family practice, those doctors, they saw a little bit of everybody. So I also was assisting with vaginal exams, pap smears, some cervical biopsies and things like that. Like I've assisted with inserting IUDs and things like that. So, and I've also actually, one of the male doctors I worked with, he would also allow me to, once he took the vaginal sample, he would allow me to look under the microscope with him, and we could see whether the person had a yeast infection, bacterial infection, even trichomonas, right? Even sometimes you could tell if the woman had just had sex, because you could see the sperm, you could see the sperm in the floating around in the specimen as well. Sperm stays alive for a few days inside the woman's body, so it could have been like a couple days before, then not necessarily the night before. So I've seen a lot of things, right? And just like the esthetician, she's seen a lot of things. She's been doing this as well. And so that's all we can speak from, right? And one of the things that she said was that she noticed that many of the women maybe weren't wiping right, because she would see, women with tissue still stuck down there, even to the point where, she would even see feces, residue of feces, like, and they call it dingleberries. And I'm sorry, this video, if you are sensitive to hearing about certain things, you may want to stop watching. I know I got some males subscribed to this channel, so any males watching, you don't want to hear all this, you may want to click off. But women, girls, definitely you need to stay on, because this is a conversation that we all need to talk about. But yeah, she said they would have those things left behind. And so I've also seen that as well, with having to assist with pelvic exams and pap smears. And whenever I had a male doctor I was working with that day, I had to assist. Like, we couldn't, the male doctor couldn't even do the exam without a woman present, without one of the female MAs present. So we had to be there. And so I can, say just from experience, there are a lot of women who did come in with smells. Now, and I will say this too. Some of the women would come in for infections, okay? So it was expected. Like, some women, we automatically knew when it was bacterial vaginosis or trichomonas, because there was a distinct smell, even to the point where even if a woman had a UTI, like when I had to collect their urine and go test their urine, I knew as soon as I took the top off the urine cup if it was a UTI, because of the smell. So when you've been working around certain things for so long, you just know certain things by the smell, right? And so, you know, even I used to do parties, and I would sell products, and I would go out to different women's houses and teach them about their bodies. And it was initially about my products, but what I realized is that a lot of women do not know basic things about their body. Even some of these women were old enough to be my mother. There was this one woman, she wanted one of my products that you had to insert into your vagina, but she was concerned about losing it. Now, this woman who had children, this woman was a mother. She didn't know that the cervix was there to keep that from happening. She, like I told, no, your cervix is closed. Your cervix only opens up during childbirth, right? So just teaching women those type of things, and women, a lot of women didn't know those basic things, right? And so that's why I say, like, this conversation is so, you should have seen how happy I was to see this conversation come up, because these are conversations that I have with my daughter. I have a teenage daughter. I get a lot of the majority of my students are female. Like, I get male students here and there and medical assistant, but for the most part, I get females. And there have been plenty of times where I've had to have conversations. Like, there's been a couple of times where I've had to take a student to the side and talk to her. And then because I knew who it was, other students would point it out to me, and they didn't, when you're young, you don't know how to, say certain things. So they would say, Miss K, blah, blah, blah. So I've had conversations where it was several of them in the class, and I had to address them as a class and say, like, look, we're all women here, nothing to be embarrassed about. Every woman has a vagina, right? We have the potential to smell. You've been out all day, you've been sweating or whatever, you have the potential to smell. That's why we take showers. I don't like when people act like, oh, I don't stink, I don't never get funky. There would be no purpose to take a shower and wash down there if that was the case, right? And so I just like to keep it real. I like to have these kind of conversations, and that's why I wanted to make this video. And I know that not a lot of people are taught. So just a little bit of my background. My mother died when I was 10. And I was primarily raised by my aunt, which is her sister. And even though my aunt, I'm 10, my aunt, I was already used to taking a bath every day. And so she just kind of reiterated that, making sure I was taking a bath every day and stuff like that. But I didn't actually learn really about hygiene until I was a teenager. And who I call my second mom, when I got my cycle for the first time, I was about to be 13 when I got my period for the first time. And she bought me a bag with pads and a little bar of soap and all these little cute little toiletries in it. And she was the one that taught me about hygiene. She was the one that set me down. I was growing hair under my arm. She would, she taught me how to shave the hair from under, just things like that. And she always smelled so good. Like, she smoked cigarettes. And to this day, I'm 37, just turned 37. She's always been the cleanest, best smelling woman that I've ever known. And so she taught me about hygiene. And also, she had 4 daughters, which were my big sisters. And I learned from watching them, and I started, talking to them and learning from them, and them teaching me certain things. That's how I learned. And I know that not everybody does that. So I want to hopefully be big sister or even little sister to somebody today, and just give a few hygiene tips that some people may not know. And first of all, let me just talk about pH balance, because not everybody knows what pH balance is. And so pH stands for power of hydrogen, and that's the pH balance is a measurement of acidity versus alkalinity in the body. Now, the more acidic your body is, the more prone you are to infections and things like that. So we want to be more on the alkaline side of the scale. And the normal number, and this is something that, as far as pH in the body, period, this is something that men have to concern themselves to as well. We always think about pH balance and we think about women, but this is important just in the body overall. So, and like I mentioned, the more acidic, the more prone you are to infections and things like that. And so, a good number for the body itself is 7.3 to like 7.4. I'll link it below. I'll fix it in the description box if I'm incorrect, but about 7.3 to 7.4 in the body, right? And so in the vagina, though, pH balance in the vagina is a little lower. Now, the lower the number, the more acidic your body is. And so in the vagina does tend to be more acidic than the rest of the body. So the numbers for the vagina is lower. The numbers for the vagina should be between 3.5 and 4.5. Now, this is something you could actually test. You can get it tested at your doctor's office. You get your urine tested. You can go to the drugstore and get a pH balance test. So there's ways to check your pH balance to make sure that you're on a scale. So I want to talk about just a few things that throws your pH balance off, and then I'll just give a few tips on just some feminine hygiene tips. So one of the things that can throw your pH balance off is foods, like foods that you eat. More processed foods you eat, the more acidic your body will be. So that's one of the things that can throw your pH balance off. Sex could actually throw your pH balance off as well. The male sperm can throw your pH balance off, right? Also, medications. So medications, if you take an antibiotic, so most of the time, I was just talking to a friend about this. Most of the time, if you get some doctors anyway, I won't say most, but some doctors anyway. I know the doctors that I've worked with, if they prescribe the antibiotic, they would also prescribe a diflucan pill, which is a yeast infection pill, because an antibiotic, you know, it kills bacteria. And sometimes it could even kill the good bacteria down there. And so when you take antibiotics, you are prone to maybe getting a yeast infection, because those good bacteria that are fighting off things like yeast infections, you know, they get killed by the antibiotics. So medications can do it. And so, like I mentioned, a lot of times you get an antibiotic, they may also give you a pill prescription for yeast infection pill, just in case you get it. Now, it's not guaranteed. Not everybody that takes an antibiotic gets a yeast infection, because I've taken antibiotics and I didn't get one. So, but then I know people who do get a yeast infection every time they take an antibiotic. So everybody's different. That's an important thing to know too. Everybody's body is different. Everybody's body reacts to certain things differently. Another thing that can throw off your pH balance is that time of the month. Yeah, like the blood itself can throw off your pH balance, because the blood is a little bit more acidic. So that could do it. And some of you may even notice a different scent around your cycle time, right? Maybe a few days before your period comes, or maybe even after, you may notice that your vagina has a different type of smell, okay? Another thing that throws off your pH is douching. Now, those douches that, you know, and this is nothing against, I don't even want to mention any brands. I'm not going to even mention any brands, but douching, what that does is it eliminates, again, the good bacteria that you have. The vagina is a self-cleansing organ, and it has good bacteria down there that are meant to fight off certain things. And so douching eliminates that good bacteria, and that throws off your pH balance, right? And that makes your you more prone to infections and things like that, okay? And so I just want to give a little bit, just a few tips. And some of this stuff may be common sense to some of you, but again, not everybody had that second mom like I had, and big sisters like I had. So I just want to give a few tips, okay? My first tip is going to be something that's maybe common sense to everybody, right? You may be watching this like, what? People don't know this? But yes, some people do not know this, and that is the importance of wiping from front to back when you go to the bathroom. Now, if you're wiping from back to front, you're bringing all that bacteria from your butt up to your vagina. So you always want to wipe from front to back, okay? Now, the reason why I know that not all women know this, because I've seen this for myself. When my daughter was a baby, I picked her up from daycare. I would never forget this. And when I picked her up, you know, before you go, they want to make sure the baby has a clean diaper and all of that. She was wiping my baby. And mind you, my baby, she's a teenager now, so this was years ago. But I picked her up, and she was changing my baby, and she was wiping my baby from back to front. And I said, no, I said, ma'am, I said, you have to wipe from front to back. I said, do you wipe yourself? And she was an older lady. I said, do you wipe yourself? I didn't say it in a rude way, but I'm like, ma'am, do you wipe yourself from back to front? If you don't wipe yourself from back to front, then don't wipe the baby like that. And if you do wipe yourself from back to front, you need to start wiping yourself from front to back. That's incorrect. And so there are women who don't know that. And so I just want to make sure I point that out. Wipe from front to back, okay? And another thing too, why yes, I do got some tissue, because this was something my second mom had to teach me, because I was using too much tissue. I remember she said, Kendra, you don't need to use all that tissue. All you need is 5 blocks. And I'm like, 5 blocks? That's not a lot. And so when you actually look at it, and she did this with me, she grabbed the tissue and she made me look at it. 5 blocks of tissue, you fold, it's actually enough. You don't need a lot of, this may be 6 blocks. This is it. Okay, no, this is 5 blocks. So yeah, fold that tissue up and wipe. And if you got to wipe again, do so. But you don't need a whole lot of tissue is not making you wipe good, right? So you take that tissue, you take that first wipe, make sure you and this is stuff, like I said, I talked to my daughter about this, my students. My daughter, she don't like stuff, you know, teenagers, they get all, you know, embarrassed and stuff when you talk to them, but we got to keep it real because we got to learn, right? So anyway, you take that first one, right? Like I said, you can wipe more than once if you need to. Let that pee absorb in that tissue. Don't just go back there and just wipe and then just get up and go. No, make sure you're absorbing whatever pee that may be still dripping. Get that tissue, let that pee absorb that, and then you wipe that, right? Then you get another piece of tissue if you need to and wipe. Make sure you're dry. Now, some people, they use wipes. Some people don't like using wipes. I like wipes, hypoallergenic wipes, not baby wipes. You can't flush baby wipes. But I like wipes. I'm a wipes person too. So if you use wipes, same thing. You take one, wipe that first time, and then I tend to wipe again with a piece of tissue anyway after wipe because I don't like to feel wet, right? And that's not really good either, walking around like moist like that anyway. So if you do use a wipe, just make sure you're dry. And so that'll be my first tip, just making sure you wipe from front to back. Other thing too, you can just use a mild soap. Like, don't use any harsh soaps down there. Bath and Body Works and all that stuff, those body washes and stuff, don't use that down there. You want to have a soap just for down there. I love Dove. I know that not everybody likes Dove, but most of the people I know actually uses Dove. Or some type of insensitive soap. Some people are insensitive, are very sensitive down there. I know some people that can only use Ivory. I know some people that can only use natural soap. So whatever, you know you. So just make sure you're using a soap down there that's specifically for that area. Also, a different washcloth. You shouldn't be using the same washcloth down there that you're using everywhere else, okay? So have just that specific washcloth just for down there. And when you're washing down there, don't be washing in the vaginal opening. Don't be all in the vaginal hole, right? Because the vagina is a self-cleansing organ, as I mentioned earlier. You don't have to get up all in it. You don't want to wipe away that good bacteria anyway. So all you need to do, if you got a ledge in your tub that you can put your leg up on, put that leg up on that ledge. If you don't have a ledge, put it up on that wall or squat and open that labia up, the lips, and you get in there. You get in there and you wash good. In one area, I had this conversation with a couple of women. We were all talking, and they admitted that they missed this area. And so this is why I'm doing this video, because again, not everybody had that big sister or that second mom, right? You want to make sure you do not miss that area between the vaginal open and your anus. The perineum is what it's called. So that area between your vaginal opening and your anus, that little area down there, make sure you clean that area too, because people miss that. All right, get that area. It's a lot of odor up in there. And those vaginal lips, get that. Now, once you get out the shower, make sure you dry off thoroughly, especially if you had hair. Now, hair is a personal preference. Hair is there to protect us, right? But some people, they wax, some people, they shave. That's perfectly fine. That's your preference if you want to do that. But if you have hair, when you're washing, make sure you're, just like when you shampoo your hair, you're washing that hair, make sure you're actually washing that hair there, right? And then thoroughly dry it when you get out the shower. Pat it, make sure it's thoroughly dry when you get out. Also, it's good to keep toiletries in your purse or in your car if your purse is not big enough. Little tiny bar of soap or little cleansing wipes, a washcloth, extra pair of panties in case anything happens, deodorant, mouthwash, and things like that. Those are important items to keep on you if you're a woman. Drink plenty of water, okay? And the last thing I would say is to just know yourself, right? Everybody has a scent. Everybody has a distinct scent. So recognize when your scent is off, right? Now, if you're noticing like a fishy odor or something like that, that's some type of infection. That is something that you cannot just simply wash away, because guess what? You go take a shower, you could try to wash it away if you want to, but it's still, that smell. I had to start recording again. The ending of my video got cut off. So luckily I was able to get everything out, but I hope I didn't leave anything out. The last thing I would want to say, I think I left off on just making sure you recognize your scent and things like that. And I left off on if you have like a fishy odor. Now, fishy odors is caused by bacterial vaginosis. Bacterial vaginosis is a bacteria infection, okay? Now, some doctors do refer to it as an STD because of the fact that it's mostly spread through sexual sexual intercourse, okay? Now, it is true that a woman can get BV on her own. So I just want to make that clear. Women can get BV on their own. However, it's mostly spread via sex. Now, the man normally does not have any symptoms. So what happens is the man, he'll get it from a woman, and then he'll go and have sex with another woman and give it to her. Meanwhile, he has no symptoms. Now, BV is something that can clear on its own, but who wants to be walking around with a fishy vagina, right? So if you do get exposed to BV, they do have pills that you could take. Also, they have a gel, vaginal creams that you can take, just like with treating a yeast infection. Now, with yeast infections tends to not have an odor. Yeast infection is usually, the itching and irritation, and then the discharge is a whitish cottage cheese like discharge. And many women, that's the first thing they go to when they have an itch. They say, oh, I think I have a yeast infection. But if you're having a fishy odor along with the itching, that's not a yeast infection. Now, you may have a yeast infection in addition to something else, but usually yeast infection doesn't cause that fishy odor like bacteria vaginosis and trichomonas does. And trichomonas is an STD. I had a friend years ago get trichomonas, and then the guy, her boyfriend at the time, was trying to convince her that she got it on her own, like she got a yeast infection. Like, no, that's an STD. He gave it to her. He had been sleeping with someone else and gave it to her. So it's not like BV where you absolutely can get that on your own. But again, BV is mostly spread by, sexual intercourse. So what happens is women, they keep having sex with the same man and wondering why they keep getting infected. That's because, BV is internal. You don't just go, it's a bacteria infection that's internal. You don't just go take a shower and wash away BV, right? So you keep going sleep with the same man, and you're going to keep getting reinfected. So this video, I didn't expect it to be this long, but I hope it was helpful. Again, I just, the comments went viral. This is something that I enjoy talking about anyway. Talk to my daughter. She doesn't like it. Like, like I told her, I'm your mother. It is my job to make sure that I teach you the right way in all things of life. And this is one of them. You're a woman. You're going to be a woman one day. You're a young lady. And so these are the conversations we have to talk about, because women who have hygienic issues were once girls who had hygienic issues and weren't taught, right? And we know this to be true. We can go in a woman's bathroom today and see how nasty it is. I remember when I was a little girl, my mother, before she died, I remember when we used to go out, a lot of times we would go use the men's bathroom if there weren't men in there, because the women's bathrooms are always so bad. The girls' bathrooms are always so bad. You go in the bathroom, tampons on the floor, pad is smeared on the seat, blood on the seat. So if women are doing these things in the bathroom, you can just imagine the lack of care that they're taking of themselves. So I hope that this video was helpful. If you found it helpful, if you liked it, make sure you like the video for me. If you haven't subscribed and you like to do so and hear more from me, go ahead and do so. If you want to share this video with someone that it may help, go ahead and do that as well. And again, thank you for visiting my channel, Medical Assistant with Miss K. Be blessed.